Ever wondered why a common cold sometimes spirals into something more serious like pneumonia? When we think about pneumonia, it often lurks in the shadows of our understanding, an enigma that strikes when we least expect it. You see, pneumonia isn't just an ordinary illness. It's an infection that inflames the air sacs in one or both lungs. These tiny sacs, also known as alveoli, are where the magic happens, the exchange of oxygen and carbon dioxide that keeps us alive. Now imagine these sacs filling up with fluid or pus. Breathing becomes difficult, and oxygen can't reach your bloodstream. It's like trying to breathe underwater. That's what pneumonia feels like. But here's the kicker. Pneumonia can be caused by a variety of organisms, including bacteria, viruses, and fungi. Intrigued? So, what causes this inflammation in the lungs? Let's delve deeper into the root cause in our next scene. Believe it or not, pneumonia is primarily caused by infectious agents such as bacteria, viruses, and fungi. The most infamous of these villains is the pneumococcus bacteria, a microscopic menace that wreaks havoc in our lungs. But it's not always a biological invader that's to blame. Sometimes pneumonia can stem from inhaling certain toxic substances, a nasty side effect of our modern industrialized world. It's a bit like a game of Cluedo, but instead of Colonel Mustard in the library with a candlestick, it's pneumococcus in the lungs with a whole lot of mischief. And just as you'd investigate the scene of the crime in Cluedo, understanding the cause of pneumonia is crucial in figuring out how to treat it. So, now we know what's causing this lung-based chaos, but how can you tell if you're the victim of this microbial crime spree? Knowing the cause is one piece of the puzzle, but how can you tell if you have pneumonia? Pneumonia, like many illnesses, has telltale symptoms that can help in its early detection. The most common of these symptoms is a persistent cough, often accompanied by the production of mucus, which can be green, yellow, or even bloody. A high fever is another common symptom as the body fights off the infection. This fever may also cause chills and sweating. Chest pain is another key sign to look out for. This pain usually worsens with deep breathing or coughing. Difficulty in breathing or shortness of breath is another sign that something may be amiss. This symptom often becomes more pronounced during physical activity. Keep in mind that these symptoms can vary from mild to severe, and they may come on either suddenly or more gradually. It's also worth noting that the severity of symptoms does not always correlate with the severity of the pneumonia itself. These symptoms should not be ignored. But how is pneumonia treated? Pneumonia may sound intimidating, but with the right treatment, recovery is possible. Let's dive into the common ways to battle this illness. First and foremost, antibiotics are typically the go-to treatment. They're designed to combat the bacteria causing the infection, helping your body regain its strength. However, it's crucial to complete the full course prescribed by your doctor, even if you start to feel better. But what if your pneumonia is caused by a virus? Well, in this case, antiviral medicine may be the solution. This works to inhibit the growth of the virus, giving your immune system the upper hand. Now, aside from these, over-the-counter cough medicines can also help by reducing your urge to cough, thus providing some relief. And let's not forget the all-important rest. Your body needs energy to fight off the infection, and that's where good old sleep comes in handy. Pneumonia can be serious, but knowing the cause, recognizing the symptoms, and seeking the right treatment can make a world of difference.